Tell me about this weekend. Where do we stand after the weekend?
So we're still doing okay. There was kind of a little bit of an uptick in Ohio, and that's a little concerning. I think maybe people are loosening up a little too early. So I wanted people to remind people to remain vigilant. But I think we're still okay. We just have to be very careful.
We're opening up stuff now. What's your advice as we begin to open up and begin to move around a bit more?
My main advice is even as we open up and get to move around more, people still have to be careful. This is, it's we fall back into our old habits of, not washing our hands as much, not touching our face, not wearing a mask, because that's not an old habit at all. And so we just have to be really careful. Now's the time actually for increased vigilance, not relaxing.
Late last week, the governor extended the what he's calling now the Stay Safe Ohio order through the end of this month. What are the factors do you believe kind of led to that move?
Well, I think he acknowledged that you can't order everybody to stay in their homes anymore as you're opening things up. But the key to extending the order, the idea of staying safe. So as he's liberalizing what we can do and where we can go and what businesses can open, he's trying to remind us that the coronavirus is not gone. We're not at zero cases. We're not New Zealand or Australia. There is still a lot of coronavirus out there, and there's still a lot of people who are at risk. And so we need to be very careful about what we do over the next several weeks or months.
At the very top, we talked about this new study coming out of London, coming out of England, involving children in COVID-19. What can you tell us about this?
Right. So the first thing I want to say is that doesn't change the overall picture that children are still overall doing very, very well with coronavirus, and that the numbers of kids who are getting sick are still very well. So I want to provide that reassurance to parents. All it's really doing is telling us a little bit more about what COVID-19 can do to kids. We were aware that in adults, there's a lot of inflammation that seems to come along with this virus when that picture of the ARDS and the inflammatory process. Well, it turns out that it is very capable of doing that in children as well. We're seeing cases in kids where they come into the hospital very, very inflamed. Sometimes they're so inflamed they're actually in shock and they have to go into the ICU. So that is happening, and it can happen, but it's still very rare in children.
So no need to be concerned, more like just being aware about the situation, right?
Just being aware, making sure that you're keeping an eye on your kids, and letting us know if you see anything concerning. What I don't want is for parents to be like, oh, kids can't get coronavirus, kids can't get it bad, and then they might overlook or ignore some symptoms. So if you're just not sure or you're concerned, just let a pediatrician know.
Got it. Dr. Amy Edwards, thank you very much for your time this morning, and continue good work and stay safe as you're out there doing what you do. Appreciate you. Thank you so much.
Yeah, you have a good day.
You as well. Thank you.